welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's top health news. Holding an eye hospital, it's operating ophthalmologist and anesthetist guilty of medical negligence while conducting squint eye correction surgery. The NCDRC has recently directed them to pay ₹1 crore compensation to the parents of a patient who died on the operation table. The top consumer court held the anesthetist guilty for not warning the operating surgeon about possible reaction from medication and also held the hospital vicariously liable for the death of the patient 22 years back. The counsel for the hospital and doctors submitted that the entire treatment had been done as per the standard of practice. While considering the role of the cardiologist, the commission noted that no doubt the child was about 8 years school going. Thus, there was less possibility of congenital anomaly. But we cannot ignore that the child was suffering from bilateral squint and chest deformity, which were congenital anomalies. Therefore, the cardiac anomalies cannot be ruled out in this case. Moreover, if one physician notices functional murmur, then the expected skill from the super specialist, that is the cardiologist, was more and higher degree of care should be there. It is lacking in the instant case, and unfortunately the child was declared fit for GA. Thereafter, holding the hospital vicariously liable for the acts of medical negligence committed by the doctors, the commission observed that when a patient goes to a hospital, he or she goes there on account of the reputation of the hospital and with the hope that due and proper care will be taken by the hospital authorities. If the hospital fails to discharge their duties through their doctors being employed on job basis or employed on contract basis, it is the hospital which has to justify the acts of commission or omission on behalf of their doctors. Considering the fact that there was no chance for the mother of the deceased for having another child, and also after taking note of the fact that the litigation was pending for 20 years, the commission awarded the complainants with ₹1 crore compensation. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.